Jake Leach, thank you so much for joining me once again. Always appreciate your updates. Thanks for spending some time with us.
Oh, it's great to be here, Stacy. Love it.
Yeah, we got a lot to talk about, but I want to start with the recent indication and change from Medicare to allow more people with type 2 diabetes to access continuous glucose monitoring. Can you talk a little bit about this? Because obviously this affects Dexcom, but you had a lot of studies and things about this as well.
Yeah, we did. So, it's really exciting for the Medicare community and diabetes community in general, but it's the largest single decision for access ever for CGM. So, meaning that single decision for Medicare to cover it for this new population. It's the largest population that has gotten access to CGM at one time. So, we estimate it's about 1.5 million people in the United States now who didn't have access previously to CGM now have it covered by Medicare. The population that is covered here is people on basal insulin, so taking basal insulin, and also anyone who has hypoglycemic events, right? Whether kind of treated by a physician or even by themselves, if they're having problematic hypoglycemia. That also makes perfect sense. The CGM is perfect for helping detect and manage hypoglycemia as well. So it's a really exciting group of folks who actually just got finalized a couple of weeks ago, where now the coverage is there. And so people can begin accessing CGM through Medicare. So background on it was there was a significant number of studies, as you mentioned, that were kind of the evidence to prove. So no payer, whether it's Medicare or a private insurance, is going to cover a product without ensuring that it has a clinical outcome. And so we ran a study called Mobile, which was about 175 people with type 2 diabetes that were taking basal insulin. So one shot a day, basically, of insulin. And in that, we basically, 2/3 of them used CGM and 1/3 of them used finger sticks. For a period of about 8 months, and we tracked them the whole time. And what we saw was in the group using CGM, significant reduction in their A1C over that period of time. So this was all done with G6 product. And so we saw a great outcome there. We also saw really significant time and range improvements in the CGM group. And so that's really the outcome that we believe will not only improve people's lives and they're living with diabetes, but also, and help with the cost of care, right? As you improve those outcomes, you're going to reduce the cost of those patients per year.
As you said, you have to show these things in studies before anybody will pay for them, regardless of what the insurer is. I'm curious, what do you think? And if you can't suppose, it's okay. I get how these things work, but I'm curious what you think happened there. Somebody taking basal insulin isn't doing insulin adjustments during the day. They're not, right? They're not giving themselves a little bit more for this. They're not covering a meal more accurately. So what was it about the continuous glucose monitoring that changed the outcome, do you think?
Yeah, it's a great question, Stacey. So, it's basically the consistent feedback that you get from CGM, right? Real-time CGM gives you those, as you know, gives you those readings every 5 minutes throughout the day. And I think what it does really is it gives you insight into what's really going on with glycemic variability, meal, diet choices, and exercise. All of those things factor into glucose, as well as stress and other things. And CGM is such an amazing tool for learning about yourself as an individual and how your body processes food, how it reacts to medications, right? One of the things that we've seen is that when you're using CGM and you're taking a medication for type 2 diabetes, you can see the effectiveness of the therapy immediately. It's not like you have to wait the 3 or 6 months to go in and get an A1C check to say whether you're doing better or not. It immediately shows you that your glucose is in better control. And so I think all of those things combined are what is why CGM it makes the impact it does, even on people who aren't taking mealtime insulin, like you mentioned.
Yeah. I have to ask, 175 people, it's not a big study. Do you think it was effective because there's so much data about CGM already, people with diabetes? Did it just build on other previous studies?
Yeah, I think, the main thing was, because one of the things about clinical studies is when you have a big impact, from a statistical perspective, you don't have to have as many patients. So we felt very comfortable that with that size and knowing how much CGM, the impact it'll have on the A1C, we kind of said that's about the right size of the study, because we already kind of knew what we were going to see coming into that, because we know CGM improves outcomes. So there's also, there's a lot of data out there, right? A lot of different studies have been run. This was the one that was a randomized control. Mobile was a randomized control trial in the primary care setting, which is unique too, right? It was not run by endocrinologists, it was primary care. It was also run in a very diverse group of individuals, both socioeconomic as well as racially diverse. And we did that on purpose to basically disprove some of the thoughts that were out there around, only certain people can benefit from CGM. And so we basically kind of dispelled that with the study, as well as showing the overall improvement in time and range in A1C. So it was a pretty powerful study, and it was the main piece of evidence, although there was a lot of other evidence used as well for that Medicare decision.
Yeah. I'd love to talk more in depth sometime about general practitioners versus endocrinologists, because people with type 2 mostly. Yeah. I mean, my husband, I don't think has ever seen an endocrinologist, and he's got a great GP, but at the same time, they're not specialized. Are you doing tons of education for those doctors?
It's a big part of it. It's awareness that the technology exists, right? Awareness that it's out there, something better than finger sticks, and then also awareness of the impact clinically it has on their patients. And so bringing that awareness is a super important part of our strategy as we move forward. We've expanded, a number of years ago, we expanded our sales force primarily to be able to call on those primary care physicians and get in there and talk about CGM and talk about the benefits, and talk about, how it can improve clinical outcomes. So it is an ongoing process. I mean, awareness for CGM is much better now than it was even a year or two ago. But there's still more to come here. We've got, there's still, plenty of people out there who don't have coverage for CGM that could benefit, that have diabetes. If we think of beyond the basal insulin using populations. And so that's another, clearly we're focused on bringing more access for CGM.
Before I move on from the type 2 crowd, I do have to ask, you said, you're exploring different ways to get more coverage for CGM just for having diabetes, not necessarily using insulin. Do you think that would include using some of the other injectables, the brand names that we've all heard, like Wegovy, Mounjaro, all that stuff? Ozempic.
100%.
Okay.
Yeah, we've actually seen smaller studies where we're seeing very similar A1C improvements with people with type 2 diabetes on orals and on those injectables. And I think, CGM is a great companion for any of those therapies, because, as I kind of mentioned, it shows an individual who's taking, it's either injectable or an oral, and it shows them the outcome that they're getting by taking the drug. And so I think that's a really powerful component of diabetes therapy, is to say, yeah, I'm doing better. I'm able to control my glucose. I feel better. That's a big part of what CGM unlocks for people.
Great. All right. Let's roll on to G7. The rollout happened several weeks ago, but still finding its way through insurance, that sort of thing. Any updates? I know that when a new product comes out, people are always worried, is my insurance going to cover it? How's that going? Any hiccups to report?
No, things are moving faster than we expected on that front, right? We put our bridge program in place, which was basically a program that would cover, it was a very approachable cash pay price for G7 while we were kind of getting coverage for both the private as well as the government insurance. But, we've got Medicare coverage for G7 now. We've got the vast majority of the commercial contracts are done. So it's coming very quickly. We'll keep the bridge program in place for a little bit longer, but G7 coverage is going great. There's always, though, we've had plenty of customers that try to get it, and something wasn't quite there yet. But that, every day that keeps getting better and better. And so the launch is going great. We've got a lot of new customers, so new to Dexcom. About half the people on G7, kind of in the US and also internationally, are new to Dexcom. And then the other half are folks that have been upgrading from G6 to G7. We still have a large, in the US, we still have a large base of people using AID systems that are on G6. And so as soon as those systems are compatible with G7, they'll be upgrading. So yeah, it's going great. And we've been, continually increasing our capacity. So the launch of G7 is unconstrained in all the markets that exist, meaning, there's no phasing of who gets the product. If you want it, you can get it. And so that was a very important part of our readiness for launch, was to have the capacity. And we're going to continue to build more and more manufacturing capacity throughout this year and next year.
Great. You mentioned the AID systems, Tandem and Omnipod. Those companies are responsible for that. You have told me that before. Can you give us any update on how it's going?
Things are progressing to plan. I think those, ultimately the actual introduction timing is up to those groups, but I've seen plenty of data of the integrations working and validation testing and all that stuff that's been going on for quite a while now. So feeling really comfortable that they're both getting close, and when they do launch, it'll be an exciting day for those users to be able to upgrade to G7.
I got a question from a listener, and I might be wrong. They said that they both, Omnipod and Tandem, would need to submit their interoperability together to the FDA each for a separate approval. Is that true? I thought they just had to make sure it worked.
Yeah, I think, not, from a regulatory perspective, they may need to do that, but my understanding is that it's more around proving validation that the devices work, and that, G7 is compatible with their device. So, but that's probably best the question that they answer, but my understanding is that it didn't require filing.
I'll run it by each of them just to make sure. Okay, a couple of quick questions from my listeners about the G7. Can you talk a little bit about smoothing? They were curious first of all, they were curious about, well, let me start like this. Could you explain what that is? And if you could talk a little bit about the G6 as well, for those who are still using that.
Yeah, sure. So, smoothing in general, the concept is you put some averaging into the readings so that you get a smooth line, right? A smooth graph. And I think, in the past, with some of the previous sensor technologies, some of our, including our very early sensors, we had to do a lot of smoothing because the sensor signals were quite variable. And so trying to kind of provide the best performance for a user, we were doing smoothing. With G6, we introduced some smoothing for the trend graph that was slightly different than the real-time displayed value. So you could get real-time display value, which was live and accurate, but then by the time it got to the trend graph, it got smoothed a little bit to give an average. We actually removed that from G6 based on user feedback. So we got a lot of feedback from users that we're much more comfortable having just on the trend graph, because you remember you can slide along in and see the values.
Right.
Much more comfortable with those being exactly what the readings would have been and not smooth. So we basically removed it from G6. We've also did not implement it on G7. So we don't have smoothing built into either of those. So the readings are on the trend graph are the readings that were displayed or what basically were transmitted every 5 minutes.
Got it. You and I had talked in the past about the silent all alarm.
Yeah.
I may be saying that incorrectly, but that's that alarm, as I'm seeing it, is you get an alert, you say, I know I'm going to be high, I'm eating an ice cream sundae, tell me later. And you can silence that for a long time. We didn't get that on launch in the US. They have it in Europe. Any update?
It's coming very soon to the US. So we've worked with the FDA to get them comfortable with the feature. We actually had a workshop a week or two ago with the FDA and JDRF and Helmsley talking about the need for the importance of that type of a feature. And so that was a really great discussion amongst Dexcom and other CGM makers, as well as the FDA and Helmsley and JDRF. And so really kind of good acceptance of the need for that type of a control over the alert system, which we knew from the beginning, right? It was a strong user requested feature that we implemented, and it's out in Europe now. People are really enjoying it and using it safely. And so we are bringing that to the US here very shortly. We've actually, one of the things if G7 users will notice is we've started doing quite a few updates to the G7 app. So it's kind of playing through what I told you before, which is G7 is going to have a lot more frequent updates than our previous generations based on the way we've designed it. And so we launched a new version just a couple weeks ago that G7 app that streamlines the account creation process. So that was a point that folks were giving us feedback on, is the email account creation process and stepping through and then jumping in and out of the app to do it. That there was, it took long, it was confusion. So we streamlined that. And so that went out a couple weeks ago, and we've got another release coming out soon that has other enhancements. And Silence All is on the very near term list. So that'll be coming to the US here quickly. And it's basically within your alert profiles. You can turn it on at any time, or when an alert goes off, you basically can zip into the profiles and say you'd like to silence it. You get to pick from 10 minutes up to 6 hours. You can basically pick how long you want those things silenced. The most important part about Silence All is it allows you to silence the alarms, and then it automatically will turn them back on after that period of time. You don't have to remember to turn your alerts back on, which is something people would, if they didn't want their alerts alarming them, they would try to turn them all off, and then you have to remember to turn them back. So it's a significant convenience and discretion factor that we believe is really important for users. And so we're going to get it out here shortly.
If the user uses that, what does it do to the follower? Is it a silent all to the follower?
Nope, doesn't change anything. The follower's settings are completely separate from the user, right? When you set up your followers, you can recommend settings for them, but at any time a follower can go in and change their settings. And so it just impacts the local alarms for the user. Followers still get the exact same experience.
Yeah, I heard a lot of teenagers and young adults sigh when you said it didn't affect the follower. They're like, I want to mute my mom for 6 hours.
Yes, there's the whole rules of engagement with follow.
And when you said there have been a lot of updates, one came through that it was, I'm going to read it, bug fix to stop notifications from pausing music, CarPlay, and podcast apps. This was another one we had talked about where it kind of breaks through, like, hello, listen to, forget what you're listening to and listen to me. That's gone.
So it basically, there were some issues with the way it was doing that. And so we removed it so that it does, you can still get your alerts when you're listening to music or something. It just does it more seamlessly and more smoothly than it was doing it before.
Great. Because, my listeners listened very carefully. And one of them said, they didn't give you the straight story. They said that was never going to be removed. And then they removed it, but it's still there. It's just
still there.
It's just nicer.
Yeah. It just works more smoothly.
Because I got to tell you, between the not being able to silence all and the breakthrough of the CarPlay, my son turned off a lot of his high alerts.
Yeah.
Probably all of them. I mean, if I'm being honest, and he's still doing great because those AID systems, man, thank you for doing that when I had a teenager. But I told him about the bug fix and he has now turned it back on.
Cool.
So thank you for that.
There's that new alert in G7 that's the delayed high alert. So you can basically set it so that it doesn't alert you for a period of time when you're over threshold, for the exact purpose of, I know I just ate, I'm not expecting my glucose it'll pass the threshold, but I expect it to come down, and we'll only alert you if it doesn't come down. So that's a G7 feature that we're seeing a lot of people who are using it are getting great outcomes, reduced rebound hypoglycemia, right? So they're not treating on a high that they've already treated. And so what we aren't seeing, a tremendous number of people utilizing the feature yet, because I think it's brand new. So we're trying to bring more awareness that it exists.
That's great. One thing we don't talk about enough, when I say we, I mean me, is pregnancy. And, with type 1 diabetes and gestational diabetes. And I know that the G7 is indicated for this. Is it well covered? Do you find that women are able to get covered pretty easily for both, for type 1 pregnancy and gestational diabetes?
Coverage exists. We're still working through that. I think getting the indication was the number one piece to unlock coverage, because everybody wants, gestational diabetes is another important aspect of diabetes, has to be managed. And so, pregnant women with type 1, they definitely had coverage, right? But the gestational group, there was some coverage out there, some not. But with now removing that contraindication, we now basically have access to that group, and it's basically 1 in 10 pregnancies experience gestational diabetes. And so really feel like CGM is a great tool for them to better manage glucose and see the impact of insulin and not have to do finger sticks and all that part. Really simplifies things. And so it is a focus for us to bring more awareness into that segment, and then also ensure that the coverage is there.
That's great. Another question I did get in the group. We have not used G7 longer than, a week or so, so I can't speak to this. But one of the questions came through. It seems like there is more signal loss with G7, at least for this individual, and a couple of people chimed in that they agree. Is that something that you've seen systemically, more signal loss with G7 than the G6, or is there any advice to curtail that?
Well, I'd say I take that a couple of different ways. We have, people are wearing sensors, in slightly different locations, a slightly smaller sensor. We are seeing complaints on signal loss, but, we also, with G6, we saw some of that too. We are working on some exciting enhancements to strengthen the Bluetooth performance of G7. And so while, some customers, there's a lot of kind of feedback on the FAQs around how to improve it. And one of the things too is with G7 now, it's a new transmitter every time, so you're doing through the pairing process. One of the things that's in our FAQs is to go in and make sure you clear out all your old your transmitters as you kind of use them. You can go into Bluetooth settings and remove them. That's one of the tips and tricks. The other one is kind of turning Bluetooth on and off. But they're, both on the mobile platform side and on the G7 hardware side, we're making some exciting enhancements coming. G7 is brand new for us. We've been learning all about it. And so we definitely when we launched G6, signal loss complaints were up at first because it was a new product for a lot of people. And so we definitely acknowledged that, hey, we want to keep making that part better. And it's such an important, ensuring reliable communication. So it's top on our list of things that we're working on to continue to enhance the G7 platform.
Great. The other feature that I think is really interesting is the ability to go to more than one medical device, right? Eventually, G7 will go to 3. If you're new to this, I guess I should explain it, or let Jake explain it, but you can go to your phone and a medical device right now, i.e. a receiver or an insulin pump.
Soon to be a pump, yeah.
Soon to be, and it could be 3. So you'd be able, what's really handy about this, honestly, in our circles, is kids at camp. Because right now, a lot of camps do not allow cell phones. So if your child is using the cell phone as their Dexcom receiver, they have to switch over to an actual receiver, and that can be difficult for some people. Anyway, I'll stop explaining it. I'll let you explain it. This is coming. Any timeline or anything to add to that?
So it's basically, it's consistent with how G6 works that way too. So G6, it talks to the mobile app and the receiver at the same time, or it talks to the mobile app and the pump at the same time. G7 will do exactly the same. The enhancement with G7 is it can also talk to a third device, which is intended to be a smartwatch. And so the kind of direct connection to the watch is something that we've implemented in the profile for G7, so in the hardware, and then looking to bring it out as a feature as we update our mobile apps across the different platforms, particularly the iOS platform. So we're continually working on that with Apple. I think we mentioned before, the number one thing on direct connect to any device, phone, pump, or watch, is to ensure that you get reliable alerts and alarms, right? That is the most critical, safety critical thing that our device does. And over the years, as we've worked with the Apple Watch platform, ensuring reliable alerts has been one of the biggest challenges, because there's so many things that can impact it. And so I feel like we're getting really close. We had some great work with Apple very recently on some watchOS updates to further enable this and ensure that it's reliable. But yeah, that's what's already built into G7, and we just have to get the software and the OS systems compatible.
When you meet with Apple, do you ever ask them like, "Hey, how's it going for your non-invasive glucose monitoring, guys? How's that going?"
They don't, like, Apple's, they have a culture of ensuring that things stay very confidential.
Oh yeah.
Actually, none of the public comments about that are the things that we've heard have ever been attributed to to Apple. It's always been, some rumor that somebody says about it. So we don't really know.
Yeah, I agree with you. I hear every podcasting conference I go to, there's a lot of Apple fan guys, and they're always in my face like, "Did you know that they're going to have non-invasive glucose monitoring on the next?" And I'm like, "Okay, that's great." As one of my favorite people says, "Wake me when it ships."
Yeah. I've been
one.
hearing the same thing for 25 years.
Yeah. But to be clear, what I was saying there with I know the G7 was built to have that watch capability, but that third device doesn't have to be a watch eventually, right? It could be just a receiver and a phone and a pump.
It could be. We've got it configured right now to be for a watch.
Oh, okay.
That's the way it's configured right now. But the idea, though, was that we want to be able to communicate to, basically, we want the data where our users find it most convenient. And so the idea was, let's continue to expand the number of devices we can communicate with.
All right. Before I let you go, G8. Anything you want to share? Any look down the road? Any fun stuff?
I'd say there's lots of innovation going on here at Dexcom across the sensing platforms, glucose and other things, and as well as the wearable platform and the deployment systems. And we're always innovating, right? And so we keep that stuff pretty tight to the vest. So not a whole lot to share other than we design our products based on user feedback. And so we take all of that into every generation we build. And so there's some exciting stuff coming with the next generations.
Great. Well, I will say before I let you go, when the G6 came out, which I think was 5 years ago now? Was
2018.
2018. Yeah. So 5 years ago, around this time of year, I cannot tell you what a jump in independence that meant for my son. He was 13. He had never put on a Dexcom by himself. And we have never done a G6. He has done them all by himself. It really represented a leap forward. He started doing infusion sets. He just took off, diagnosed at 2. And we had, I think for little kids, people diagnosed very young, it's hard for them to really get that independence because we're so hovery. Right. They're used to it. It really was a demarcation point that I can look at. And so I'm thrilled that G7 is even easier. And I'm sure, I don't want to do the commercial for you here, but I'm sure there's going to be lots of people, whether they have mobility issues or they're little kids with more independence, that really take this new innovation and move forward. So I don't know, Jake, thanks so much. I can't believe my kiddo's 18. He's leaving me going to college. So
pretty exciting. Pretty exciting. It's awesome. Yeah, I remember when we first started chatting. So it's been, it's been great to see.
Well, thanks so much for all the information. I'm sure we will talk soon.
Cool. Great, Stacy. Wonderful to be here. Thank you.
Thanks. All right.